Hi, I'm Dr. Patrice Harris, Director of Fulton County Health Services. Fulton County's Health Services teams serve one of the largest counties in Georgia and in the southeastern United States. Healthline is a program that highlights some of the department's services and shares some important health news that impacts our community. On this episode, we'll discuss a growing epidemic in our county, HIV and AIDS. We will also discuss how Health Services is addressing this issue with testing and treatment. Healthline begins right now. Welcome, everyone. We're discussing a major health crisis in our county, HIV and AIDS. Joining me to talk about this issue is Dr. Daniel Vanderende, who heads the county's Communicable Disease Prevention Branch. Also, Teresa Bell joins us. She's a health program coordinator. And Leisha McKinley Beach is the administrator for our HIV prevention program. Welcome to Healthline. Decades ago, HIV was more like a death sentence. So Dr. Vanderende, talk about the medical advances that we've all experienced in the last several years since the beginning of this epidemic.
Well, Dr. Harris, we've come a long way. When HIV was first noted, there was no treatment. People who contracted that disease died. Then there was a medical advance where AZT came on the market and there was hope, but then there was drug resistance. But fortunately, we have been able to come up with classes of medications, combinations of medications that have turned HIV from a death sentence to a chronic disease that's manageable, and now people no longer die from AIDS, but they may die from old age, cancer, strokes, and heart attacks, and other conditions that also need to be addressed. But we've come a long way. The other thing that's very exciting is that we've been able to introduce PrEP, pre-exposure prophylaxis, into the medical lingo arena and offer that to clients. With this medication, which is an antiviral medication, a client takes that on a daily basis and protects themselves like you would a preventive medicine, similar to like people take it for malaria to prevent malaria. This is similar medication. You take it on a daily basis, you follow up with your primary care physician, you check your kidneys every once in a while. It's a very safe medication. And with that, there's studies that show efficacy in preventing the transmission of HIV.
Well, that is good news, and I think at the foundation of what you're saying is there is hope today. And we'll talk more about getting tested, but I think that's an important message to get out there, the message of hope. But we do have an issue in Fulton County. Can you say a little bit about the numbers regarding the incidents? How common is this in Fulton County?
Well, HIV/AIDS is a significant public health concern in Georgia and Fulton County. The CDC released statistics in 2010. In those numbers, the state of Georgia has the 6th highest number of cases when you compare it to the other 50 states. That's a very high number. What's really concerning for Fulton County is that over 1 out of every 3 of those cases resides right here in Fulton County. We also know that HIV/AIDS does not affect everyone the same. 3 out of every 4 cases, roughly, are men. Over 3 out of 4 cases are African Americans. So we have an issue with a smaller group being more predisposed to get that condition. We also know that for females, African American females specifically in the Atlanta area, their risk of getting HIV is 5 times that of the African American women in the United States. And the youth are a particular concern. Over half of the cases that are diagnosed as new cases are in the youth between 16 and 24. This is extremely concerning because it's in a preventable condition with condoms, with PrEP, with education, with safe sex practices, and this would impact them for their whole lives. And if we can get to them and prevent this condition, we could impact a generation.
So certainly those are sobering numbers, but again, back to your original points about optimism, and you mentioned getting to them, and that means that testing is key. And so Leisha, can you talk a little bit about the issue of knowing your status? Who should get tested and how often?
Thank you, Dr. Harris. HIV testing is our starting point in prevention. We can't determine whether a person needs to be linked to care until we know their status. We can't determine if someone who is high risk for HIV but is tested negative, if we can offer them other prevention strategies. And Dr. Vanderandy mentioned a prevention strategy such as PrEP. It's a biomedical prevention intervention. And we know that when we can couple individuals who are on PrEP, who may have partners who are HIV positive, that we can reduce their risk to less than 4%. So it's very promising and it's very exciting. But who should know their status? Everybody should know their status. That's why it's so important for us to work with our clinical partners to ensure that we're routinizing HIV testing so that people who walk through medical facilities are offered a test. It's important for us to work with our community-based organizations to ensure that they have funding, they have resources, but more importantly, they have the support from our health departments as they continue to ensure that people have access to HIV testing.
Well, certainly the county has a number of initiatives, and you all are a testament to the work that's going on. We were recently recognized by NACO regarding our beauty and barbershop outreach. Can you talk a little bit about that?
Absolutely. So we were very honored to be recognized for our community partnerships with our barbershops and our salons. And a part of that initiative was launched from a campaign from CDC that was called Business Response to AIDS. And so we know that there are individuals who will not come into health departments. We know that there are individuals that at this point that they're not including HIV testing as a part of their routine health care. But if testing is available for them in other places where they live, work, play, and worship, that they might access testing. And so the barbershop initiatives give people an opportunity to not only come into a barbershop for a haircut, but to also be provided with an HIV test, be provided with education, and to have a discussion around HIV that is not stigmatizing or threatening because it's amongst peers.
Thank you. That's good information. So we've got the medical advances, and we've got folks getting in for testing, but I know that we all know there's a significant problem in linking folks who do come to get tested to medical care. So Teresa, I know you've been very involved with our linkage to care programs. Can you talk a little bit about what that means and why it's important?
Sure, Dr. Harris. Well, when we look at linkage to care and what that comprises, linkage to care is sort of like the next layer of prevention. When a person gets tested and they find out that they're HIV positive, the next step is to seek medical care. And so we do have clients that are being referred to us by our community partners through testing efforts. We have clients that are walking in off the street because maybe they've transferred in from other states that are coming here to continue linking to care. And so what happens when clients come here, our primary goal and function is to ensure that we conduct an assessment on them, that we find out what their possible barriers to care could possibly be, address those particular barriers, and then the next couple of services that we provide are simply like labs and a medical provider's visit. The whole focus around linking to care is to make sure that we reach viral suppression. And so we want to make sure that individuals are not only know their status, but that they get linked to care. In fact, I saw a study that CDC conducted where they said we're doing well at testing and people understanding what their status is. But when it comes to linking to care, what we mean by linkage to care is that they are actually seeing a primary care provider, not just going to the clinic, getting enrolled, filling out a lot of paperwork, and never seeing the primary care provider, but actually having a consultation so that the doctor can review the lab results, let them know whether it's a possibility that they could be on medications or not, because all clients are not on medication. It just depends on the viral load and CD4 cell count. So linkage is very intense as well. When we look at linkage services, the other linkage portions that we concentrate on is housing. We address mental health issues, substance abuse issues through a referral process. A lot of our clients, when they normally go through the enrollment process, there's an assessment tool that's implemented. And that tool determines whether or not we need to look at intense level of linkage or basic level or moderate levels of linkage services. So if a client scores for a certain service, the linkage coordinators are going to ensure that their barriers are addressed and that their needs are being met at some point or another.
So clearly it's important to have all these aspects.
Exactly.
You know, the medical advances, the testing, and the linkage to care. I do want to get back to the testing because I know that we have a significant initiative going on called Test Atlanta. Can you say a little bit about that?
Sure. So Test Atlanta is our opportunity to combine government and community partners and advocates and civic organizations and anyone who wants to make a difference in this epidemic. I think we're at a point where we can truly look towards an AIDS-free generation. But to get there, people will have to know their status. And I think we've heard from Dr. Vanderandy and we've heard from Teresa that being linked to care is critical. And in order for that process to happen, we're going to have to include more stakeholders, individuals who might not have thought, you know, I can play a key role. You know, we have community people, we have faith leaders, we have a whole host of individuals who have influence over individuals that can say, I know my status, do you? And so as a part of Test Atlanta, we want to make sure that testing is accessible throughout our county so that more people can learn their status. We want to make sure that we're coordinating testing with our partners so that we can cover a larger area for testing. But more importantly, we also want to bring on more medical and clinical providers so that testing becomes a routine part of healthcare. And when we do that, then more people are going to know annually their HIV status. And when we do that, we have an opportunity to link people much earlier into care. And if we're going to achieve viral suppression so that people who are infected are less likely to transmit, we have to make sure that they have quality care, but they have it early. And so Test Atlanta is going to encompass all of those things. And so we're very excited to have such an initiative like this.
And Dr. Vanderandy, I'll let you close this segment. First of all, you might want to just give a quick definition of viral suppression. Sometimes us in the field use these terms. And then any closing remarks specifically regarding this whole mantra that we have now that treatment is prevention.
Well, treatment is prevention. When you go on antiretrovirals, those antiretrovirals will then attack the virus, and then the virus will no longer be detected when you draw the blood. So viral suppression is that you can't detect any virus in the blood. Unfortunately, we don't have a cure yet, but there is hope that that will eventually come to the fore. So we have the hope of, one, we have drugs that are treating the HIV virus, so you're no longer suppression, which decreases the transmission from one person to the next.
Well, thank you all for being here and sharing that information. When we come back, we will talk to the director of the Ryan White program about what the program does for qualified clients. We will also talk about the Ryan White Clinic in the health department. Stay with us. Welcome back to Healthline. I'm Dr. Patrice Harris. Today we're talking about the county's efforts to address the HIV and AIDS epidemic again in our county. And we're here with Jeff Cheek and Jennifer Creighton from the Ryan White programs. welcome to Healthline.
Thank you, Dr. Harris.
So first of all, and I think we deal with this a lot, what is the difference between the terms I use, the county's big HIV program, Jeff, which is the program that you run, and Jennifer, our HIV clinic internal to the health department. Jeff, can you tell us a little bit about the difference between the two?
Earlier, y'all were talking about how important it is to get people into care and treatment. And the Ryan White program that I administer provides that service for a 22-county area. And included in that is Fulton County. And the funds come to Fulton County, and we contract out with a variety of service providers, people who provide the medical care, such as the Ryan White Health Department Clinic that we'll talk more about in a moment. But we also fund agencies that provide food, that provide transportation, that provide case management, so that we can meet all of those needs that Teresa and Leisha talked about earlier that need to be met before someone can get into care.
And this money that comes to you, what is the source of that money?
It's federal funding. So it comes to us through the Department of Health and Human Services. We get funding every year. This year we got an increase of about $1.5 million, bringing us to a total of about $23.7 million to serve people in the Twin County area. And last year we were able to serve about 15,000 people with those dollars.
And as you said, Jennifer, Fulton County Health and Wellness Department is the recipient of some of those dollars. So, Jennifer, talk about our clinic internally and who qualifies for the services that we offer.
Okay, well, we, again, like what Jeff was saying, we apply for those funds and we receive about $2.5 million to provide medical care, primary care, mental health and substance abuse services, oral health services, and some supportive services like medical transportation, very similar to what Jeff was saying before. We receive funds for transportation, as well as food vouchers and other supportive services.
And Jeff, would that be true of most of the recipients? Do they provide similar services to what we do in our Ryan White Clinic?
Right.
Okay.
Well, what we've learned over the years is that when you're dealing with HIV, you can't deal just with the disease. If the individual doesn't have a place to live or if they have no food, the disease is pretty low on their list of priorities. So what we try to do is deal with the whole person, to deal with their physical body, to deal with their mental health, to deal with their substance abuse issues so they can get ready to get into care, and to provide the medications that allow them to get virally suppressed. And so we provide that through 7 different clinics, Fulton County being the largest and sees about 1,600 people a year. But then we also provide service providers that do the transportation or that provide the meals or that provide those other supportive services that allow people to stay in care at the health department.
And I think you also have received good news in that your program recently won an ACO award. Right. Tell us about that.
Right. Well, for about 16 years, we've had something that was formerly called the African American Outreach Initiative, which was to get people of color into care and to teach them about how they can get services. Well, we changed the name about a year ago to the Atlanta Area Outreach Initiative so that we could be a little more inclusive and include Latinos or other people who were interested in getting. The exciting thing was that we are now partnering with Leisha and the prevention program so that we're looking at individuals who are negative and how we can get them to stay negative, and how we're working with people who are positive and getting them to take care of themselves and not spread that disease. So we got an award because of the bridge that we did between the 2 programs. But the exciting thing is that it's run by community volunteers. It's a community effort with about 100 different volunteers, and it's a one-day educational program that serves about 200 people each year.
And I think we've seen that it's really critical to partner on this, both internally and externally with our community-based organizations. So, Jennifer, can you talk a little bit about how you partner with other members of the health team internally?
Oh, absolutely. We partner with Women's Health Services. We partner with our WIC program. We also partner with some external partners as well. We actually work with Aid Atlanta, which is the largest case management organization in the Atlanta area, and they provide medical case management on site. We also partner with Open Hand for medical nutrition therapy. So we have a dietitian who comes on site and provides medical nutrition therapy twice a week. And all those services are provided on site.
And talk a little bit about the case management. Both you and Jeff mentioned that it really is not just about the diagnosis and the medical treatment, but it's really about surrounding folks with other services. So can you say a little bit about case management services?
Oh, yes. The goal or the main focus of case managers is to ensure that individuals stay in care. So their goal is to eliminate barriers and to reach them from being case managed to self-managed. And they eliminate barriers like housing or homelessness. They move from emergency housing to transitional housing. They also work with our clients with food and clothing. Anything to eliminate barriers to ensure that they remain in care.
Right. And I think in doing that, that's what gives our clients hope, and that's what gives them an opportunity to live healthy, to live fully. And so it's a great partnership.
Yes.
Well, Jeff, we started with hope with Dr. Vander Ende, and certainly it's good that you sort of close the loop on that and end with hope, because it is about hope and addressing the needs of the many folks who are infected with HIV and those that, and we want to certainly prevent those who are not infected from getting the disease, again, to get to zero.
Right.
And as Leisha McKinley Beach said, to have an AIDS-free generation. So thank you both for being here today. We'll be right back with my final thoughts. Stay with us. Today on Healthline, we discussed HIV and AIDS. We talked about the services the county has for clients diagnosed with HIV or AIDS, and we also discussed the new medical advances in treatment. Most importantly, we stressed the need to get tested. The goal at Fulton County Health Services is to raise awareness and inform the public about HIV testing. Knowing your status is key. And for those clients who test positive, it is important to get into care immediately. Here at Fulton County, we believe treatment is prevention. We hope to lower the county's HIV rate down to zero, but we can't do that unless people get tested and get into treatment and care. I also want to note that the Board of Commissioners has commissioned a task force to address this issue as well. You can learn more by going to standuptohivatl.org. Well, I hope you've enjoyed this edition of Healthline. I'm Dr. Patrice Harris. And remember, you can learn all about the services of the Health and Wellness Department and the Behavioral Health Department by calling 404-612-1211. Thank you for watching. We'll see you next time.